Hello everyone, welcome to this session on neurodevelopmental disorders. In today's lecture, we'll begin by understanding what neurodevelopmental disorders are, why they occur, and what are the types of neurodevelopmental disorders. Start with a simple question. Have you ever wondered why do some children struggle to learn? Have you ever wondered why do some children struggle to communicate the same way as others? And have you ever wondered why do some struggle to move like others? Simple. The answer lies in how one's brain and nervous system develop. When a baby starts to grow in mother's womb, it undergoes certain neurodevelopmental process like the baby's brain, spinal cord, and the peripheral nerves grow. When this normal development is interrupted or affected, it leads to neurodevelopmental disorder or sometimes called NDD, neurodevelopmental disorder. This concept is mentioned as a clear definition. Let's read it. Neurodevelopment. Neurodevelopment refers to the process by which the nervous system, including the brain, spinal cord, peripheral nerves, develop and mature over time. So neurodevelopment is nothing but it's the development of brain, spinal cord and peripheral nerves. If any problem occurs in this developmental process, then the individual is vulnerable to get NDD. One simple example would be ADHD, attention deficit hyperactive disorder. When we compare the normal healthy baby's brain with ADHD baby's brain, you can clearly note the structural difference where the volume and size of ADHD brain is comparatively low. In this image, you can clearly see that the frontal and parietal cortex is low compared to healthy brain. And in addition to that, the volume of the brain is very small and cerebral vermis is equally small when we compare to healthy brain. So far we saw about what neurodevelopment is. Now we'll go to the proper definition of what neurodevelopmental disorder is. According to APA, neurodevelopmental disorder is a condition that involves abnormalities in the developing nervous system with onset typically in early childhood that can continue into adulthood. Actually, this neurodevelopmental disorder is a condition caused by differences in how the brain develops, which can lead to difficulty in areas such as learning, behavior, social skill, and movement. This disorder begins in childhood and can last throughout a person's lifespan. By prescribing medications, we can prevent the symptom severity, but we cannot cure it completely. They can influence the individual's learning, communication, behavior, movement, and even emotional control. As I told you before, all these neurodevelopmental disorders are not short term issues, they are serious, long lasting condition which has a greater impact in individuals' lifestyle and usually begin in early life stage itself, often during the childhood, and if not properly treated, it would worsen as they age. So far, we saw about what neurodevelopmental disorder is. Now we'll look into what actually causes these disorders. When we talk about the causes, there is no single reason for the development of neurodevelopmental disorder. So, but many researchers have proven that neurodevelopmental disorder often result from a combination of genetic and environmental factors. For example, certain genes or mutations like changes in the DNA sequence can be inherited from parents. If there is any family history of ADHD or learning disorders, then there is a possibility that the offspring may develop ADHD or learning disability. For example, if my father is diagnosed with a learning disability, then I have a possibility to develop learning disability. So this is a 50-50 chance. Not 100% they'll get it, but it is a possibility that they may develop, the offspring may develop. And not only from father, the genetic factor can come from their grandfather, grandmother, uncle, aunt, or even mothers. So then comes the prenatal events during pregnancy. A pregnancy women exposed to drinking or consuming alcohol or drug or any kind of infections, poor nutrition while pregnancy can also affect the baby's brain development. Then comes brain birth complications. So if the baby lacks oxygen, if the oxygen level is deprived in baby, or if the baby is prematurely delivered, so it has a possibility to develop this particular disorder. So then comes the early life event. Even early life experiences like trauma, a child falling from a height surface, blow in the head, or accidents which cause head injury, or severe stress, or lack of proper nurturing can contribute to this NDD problem. And all these factors are main factors which directly influence NDD. To better understand the birth complication factor, let's think about how a baby receives oxygen before birth. A baby doesn't actively breathe inside the womb. Instead, it gets oxygen through the mother's blood using placenta. If the oxygen supply is cut off for too long period during birth, the baby's brain can be damaged. This can cause conditions like cerebral palsy, a neurodevelopmental disorder which affects movement and coordination, or in severe cases, it may even threaten the baby's life. So the baby's brain's development is highly sensitive. Even small disturbance can have lasting effects. Even early life events can also have lasting changes in neurodevelopmental disorder. Now that we have a general idea of what neurodevelopmental disorder is, let's move to our first topic, intellectual disability. According to the DSM-5-TR, the older term mental retardation has now been replaced with intellectual disability. If I'm not wrong, till 2018, the term mental retardation was used to denote children having intellectual problem. I'll give you a small example for intellectual disability. Imagine there is a 12-year-old boy and his mother gave him 10 rupees and asked him to go to the shop and get one 5 rupees dairy milk chocolate. Now, how much balance will he have after getting the chocolate? 5 rupees, right? A normal 12-year-old boy should be able to say this. But in case of intellectual disability, the individual will be very poor in mathematical concepts. They have problems in basic mathematics, decision making, planning, and so on. With severe intellectual disability, a child may not say that they have peed or pooped in their pants. So this is a common example for intellectual disability. Now we'll start the topic. We'll see the definition of what intellectual disability is. Intellectual disability is also called as intellectual developmental disorder. This refers to the significant limitation in a person's general mental ability. This includes reasoning, problem solving, planning, abstract thinking, judgment, academic learning, and learning from experience. For abstract thinking, I'll give you an example. A student with a mild intellectual disability may have difficulty with understanding theoretical concepts like time and money. So they can understand the concrete concepts of getting one coin for doing a task, but they may struggle with abstract concepts like we have to save money for a future goal, we have to study to pass the exams. So this abstract concept they'll find struggle in abstract concept, but they can understand concrete concepts like if someone gives money you have to give them something, so they'll understand that concrete concepts, but they'll have a problem with abstract concepts. But as a psychologist, we can help them to develop abstract concepts through therapies. And also, if the individual is facing any problem in concrete concepts, we can also help them. For a diagnosis to be made, these problems must begin before the age of 18. That's why it is called a neurodevelopmental disorder. It should originate or it should begin during the developmental year itself, from childhood to adolescent. Now, some may have doubt that why did they mention it as for the diagnosis to apply, these problems must begin before the age of 18. It is because most significant growth and structural changes happen during childhood and teenage years. Again, you will have a doubt that will the brain stops its growth after 18? Not exactly. The brain continues to mature beyond the age, but the significant growth happens during childhood till adolescence. If the impairment begins after 18, it is usually due to other causes like brain injury or neurological diseases, like due to some brain neuron damage or nerve cell damages. So if that is a case, if due to this neuron degeneration, the individual have cognitive related problems, will diagnose it under neurological diseases and not under intellectual disability. Intellectual disability is usually noticed around the age of 5 or 6 when children begin schooling and learning difficulty become more visible. The diagnosis for intellectual disability tend to peak around the age of 15 and then decreases sharply after that. With basic awareness among parents and school management, the diagnosis is made in the early stages itself. So, at age 15, in most cases, at the age of 15, most of the intellectual disability cases were diagnosed. Let's understand this concept with a popular Tamil movie called Deva Thirumagal. As I told you before, kindly watch this movie to have a better understanding about this disorder, where actor Vikram played as a main character. He understands the world based on direct experience rather than abstract reasoning and often shows a deficit in judgment. They may not assess the situations the way others do. In one particular scene, he was standing in front of the court and he don't know what to do. Then Santanam came and he took him to Anushka, and they both were confused because they could not understand Vikram's conversation. So then, after slowly interacting with him, they'll come to know that he have intellectual disability, and slowly they just decoded what his problem is. Here, he basically don't know what to do. Since he had mild intellectual disability, he could manage the issue somewhat. Few intellectual disability people will have concrete thinking. They understand things they can directly see or experience. In one particular scene where Vikram, he don't know how to take care of his child. So he saw in his estate, he saw a lady. She gave birth to a child, and that new she used to pamper that newborn child. So by seeing that, Vikram will also pamper and he will also take care of his baby, like in the same way as she did. So this is how they learn. They'll have concrete thinking, but they'll not have abstract thinking. Their judgment and decision making skills will be poor. So he worked in a chocolate factory, so he was a proficient in his work. This is due to his direct observation and practice. Again, here comes the concrete thinking. So since he was directly observing and he was directly practicing the particular cookie making process in the chocolate making chocolate factory process, so he could easily do that. He will become proficient in that particular thing because he is daily practicing it. So they can easily learn how to use a spoon to eat, but they'll have struggle to understand abstract concepts like empathy. They would not be empathetic. They don't know what freedom is and they don't know what justice is and all, but they'll have concrete thinking concept. If the condition is very severe, always they need to be a caregiver to support that particular disabled individual. So if it is very mild, then they'll take care of themselves. But if the condition is very severe, then that will be very problematic. So always they need to be a caregiver to support them. So then we have vocational training. This vocational training is for special children. So special children, special adults. So everyone will participate in this vocational training. So in this vocational training, the particular special education center in charges will provide some job related opportunities like candle making or agarbatti makings or paper wrappers, so and so things. So by doing so, they will learn, the disabled individual will earn some money, so that particular money is transferred to that particular individual's account. So after receiving the account, they can use it for their medical benefits or any other purposes. So this is how vocational training is. So the main concept is when we repeatedly give the practice for that individuals, their concrete thinking or that concrete concepts will become very strong. It will become a long-term memory, and they'll easily and do it without further instructions. If you teach them for 10 days, then it will be there in their mind for 2 days. So when you repeatedly make them to do it again and again, then they'll just learn it, and they'll do it unconsciously. Vocational training helps them develop work related and daily living skills so they can become as independent as possible. This training focuses on improving conceptual, social, and practical skills to enhance self reliance and participation in society so that they don't feel lonely, so that parents will not treat them as a burden, kids, something like that, so that they can financially be independent. So next, let's talk about how we assess intellectual disability. In DSM-4TR, intellectual disability, then called mental retardation, was placed in access to disorder. But in DSM-5, we don't have such access. But still, in DSM-4TR, intellectual disability or mental retardation was diagnosed based on three main components. The first one is intelligence test score. There are many psychological tools to measure intelligence of the individual like BKT, BATIA, Segum Board, and various other tests. Based on the scores, the individual's intelligence is calculated and measured. Then the second one is adaptive functioning. Adaptive functioning refers to the individual's ability to perform daily life tasks like communicating with others, managing money, maintaining personal hygiene, and interacting with others, interacting socially. So this to diagnose or to measure these adaptive functioning, there are three main skills. There are three main skills which has been measured to find the individual's adaptive functioning. The first skill is conceptual skill. How well an individual can understand language, how well he or she can read and write a particular concept, how well he or she can tell what time it is, what time the college stats or any other thing, and number concept, how well they can work on numbers and the self directions. Then the second comes the social skills, which includes interpersonal skills, social responsibilities, civic obligations, self esteem, following rules and norms, and understanding social cues and actions and all. So then comes the third one, the most important one is practical skill. So it includes the daily living activities, safety awareness, and use of transportation, public transportation, how to use a transport, public transport, where to wait, how a bus stand looks like, and how to use a telephone. All these comes under practical skills. And all these, by adding all these scores, by measuring all these things, we can say that the individual's adaptive functioning is in so and so level. And the last component is age of onset. As we already mentioned that the age of onset is nothing but at what age the particular disorder should be diagnosed, or what age the particular illness symptom is very prominent and very visible. So as we discussed before, the intellectual disability should be prominently visible before the age of 18 itself. Before the age of 18 we need to diagnose this intellectual disability. Now, let's look at the levels of intellectual disability, which are usually determined by the IQ scores. For mild intellectual disability, the IQ score will be between 55 and 69. For moderate intellectual disability, the IQ range should be between 40 to 54. And for severe intellectual disability, IQ score should be between 25 to 39. And for the profound means very severe. Profound means very severe intellectual disability. So for that, the IQ level will be below 25. So these level help professionals to understand how much support a person might need. So next, let's look at the causes of intellectual disability. So this intellectual disability, it occurs before birth, during birth, or after birth. In order to put this in other words, we can call it as prenatal. Prenatal means before birth. Perinatal means during the birth process. Postnatal means after birth. So then let's explore them one by one. Now we'll discuss about prenatal causes. Prenatal causes or condition that occurs while the baby is still in the mother's womb. They can also affect how baby's brain and body development lead to neurodevelopmental disorder. First chromosomal disorder. A well-known example is Down syndrome, where there is an extra copy of chromosome number 21. This extra genetic material, also called trisomy 21, changes how the baby's body and brain grows. Next comes inborn error of metabolism. These are the inborn error of metabolism is a rare genetic condition where the baby's body cannot properly break down certain substances. This happens because of a missing enzyme or protein, which is crucial for metabolism. As we all know, metabolism is a process where it converts food into energy. So to break down this process, this chemical reaction, we need an enzyme or protein. This particular enzyme or protein is missing in some kids. It is a rare condition. It was missing in some kids. So if that due to that missing, the individual will have problem in their body, like bodily functioning and brain functioning. Then comes developmental disorder of brain formation. If there is any problem in the formation of the brain, brain structure, formation of the brain and brain structure, then the individual will have difficulty in cognitive processes. So then comes environmental influence. Environmental factors also play a big role. Things like pollution, cigarette smoking, radiations, or poor nutrition during pregnancy can influence with healthy brain development. So if the individual is exposed more to air pollution due to traffic, or if the individual is frequently taking some scans due to that radiations, and poor nutrition, if she is not consuming, if she is not intaking food properly, then due to that issues, the individual will have problem in their the individual means the offspring will have problem in their cognitive functionings or other bodily issues. And then comes fetal alcohol syndrome. Fetal alcohol syndrome is a condition where mother drinks alcohol during pregnancy. So alcohol can cross the placenta and harm the developing baby, leading to growth problems, learning difficulty, and behavioral issues. So this is about prenatal development. This is the pictorial representation of chromosome number 21 trisomy deficit. So in this slide, we'll discuss about perinatal cause and postnatal cause. Perinatal cause occurs during birth process, where the umbilical cord circles the child's neck, and it will make the baby very much difficult to breathe, to take intake oxygen, not to breathe but to intake oxygen. So this is called anoxia. It means complete deprivation of oxygen. As I told you in the previous slides, through placenta the baby gets oxygen from mother. So when the umbilical cord circles the baby's head, neck, or any part of the body, then the oxygen level is deprived. The oxygen level is deprived for a long period of time, then that can have a significant brain damage. So then comes the low birth weight. So this is a 50-50 possibility that if the baby has low birth weight, then they may develop intellectual disability. It is not 100% true, but still, if it's a 50-50 possibility, if the birth weight is low, then and the baby may develop intellectual disability. Then comes postnatal causes. Postnatal cause means occurring after birth. The first could be biological causes. If there is any brain injury after accident, or after any fall from a high surface, so this can cause intellectual disability. Then comes psychosocial factors. Psychosocial factor like if the baby did not take any proper adequate nutrients during after immediately after the birth, so then it can cause intellectual disability. Not a significantly severe, but still a mild range of intellectual disability. Then comes child abuse and neglect. If the child hits his or her head, or if parents shake by pampering, or thinking that they are pampering, if they shake the baby very hard, or if they hit the baby's head very hard, then that could cause intellectual disability. And also, in addition to that, parental neglect. If the parents are not taking good care of that particular baby, then it can have some kind of problems, in many newses we can see that few innocent childs, they'll just take and consume some Dettol or any other things by thinking that it is a juice or edible thing, they'll just go and have it. So this will go and affect their brain, and it will later develop into intellectual disability. So to summarize, in this session, we discussed what a neurodevelopmental disorder are, why they occur, and focused deeply on intellectual disability, its definition, diagnosis, levels, and causes. Understanding these basics help us recognize how early brain development can shape a person's lifestyle, learning, and behavior. In the next part, we'll continue with autism spectrum disorder and specific learning disability. So where we'll learn about how these conditions affect communication, learning, and behavior in unique way. Thank you for listening and see you in the next lecture. Thank you.